In our particular practice here, we see a multitude of different type patients. We see kids, we see geriatric patients, we see cosmetic patients interested in cosmetic dentistry. We see complex restorative rebuilds. One of the things I think is really important that a general practitioner gets to see almost more than anybody else is I get to see patients get old. I get to see patients grow up. I get to see patients who come in here as children, grow to adulthood, and have their own kids. So if you're interested in sociology at all, it's a really fascinating study on human development. One of the things that I think is very important is watching kids grow and making sure that you can teach them about dentistry, teach them how to take care of themselves, and make sure that the dentistry they get is of the highest quality. One of the things that a lot of kids are going to do is see an orthodontist. Do I need braces? Oftentimes, they at least need to be seen by an orthodontist, and once in a while they get braces. One of the ways that orthodontists treat kids when they need braces, at least in the city of Charlotte here, we will see often a recommendation of extracting premolars, what we call bicuspids, adult ones. And while 20 years ago when I was in dental school, this practice seemed acceptable and sometimes favored, after being a dentist for 20 years and really talking with some very excellent specialists in orthodontics here in Charlotte, it's really become quite apparent that taking premolars out on kids is something that should be awfully rare. It can happen. The orthodontists that we refer to really make a concerted effort to try to treat the child without taking out the teeth, if possible, and if we can get a great result. If we can't, we can always back up a little bit, take out the teeth, and go forward. But using the extraction of adult premolars on 12 and 13-year-old kids to treat them for orthodontics, that should absolutely not be on the front end of choices that orthodontists should make when treating children.